The recent budget proposal from the UK's Labour government, led by Chancellor Rachel Reeves, marks a major shift in economic policy with an ambitious plan to raise £40 billion in taxes annually. Reeves aims to balance public finances, tackle rising costs, and invest in essential services, making this one of the most significant budgets in recent UK history. Key changes in Reeves's budget include increasing the capital gains tax, with the lower rate rising from 10% to 18%, and the higher rate from 20% to 24%. This tax increase will largely impact property and investment gains, a move expected to generate an extra £2.5 billion annually. This is noteworthy as capital gains tax rates in the UK have typically been lower than in other G7 countries. Reeves defends the increase, arguing it's necessary to address the financial challenges left by previous governments. Another crucial measure is an increase in the employer contribution to national insurance from 13.8% to 15%, expected to bring in an additional £25 billion. Additionally, the government plans to remove VAT exemptions for private schools, implementing a 20% VAT. This has sparked debate, with critics claiming it could strain parents who already pay high tuition fees for private education. According to Independent Schools Council, there will be around 35,000 pupils will transfer to state schools over time, as well as an additional 2,000 international students leaving private institutions. The budget also aims to support low-income workers with a 6.7% rise in the national living wage, raising it to £12.21 per hour. Reeves argues that this will help low-wage earners cope with inflation and rising living costs, although opponents warn it might pressure businesses already struggling with higher taxes. A significant portion of the budget is dedicated to public spending, with the NHS receiving £25 billion over the next 10 years for ongoing reforms. This includes funding to address staff shortages and improve service quality. In the UK, the NHS has been a cornerstone of public health, but it has faced funding and staffing challenges, especially since the pandemic. Increased spending on healthcare and social services, essential for public welfare, aims to address these long-standing issues.